Hello. I just wanted to go over your individual disease presentation and your narrated PowerPoint presentation that you're going to have to do. Each student's going to be able to choose a disease, an infectious disease, any one of your choice, and develop a 10 to 15 minute narrated PowerPoint presentation introducing to the others in the class the disease. Be aware that this is going to be worth 10% of your final grade, and what you're going to do is you're going to audio link either a Camtasia, PowerPoint, you can use whatever program you like, and you're going to basically give an oral presentation on PowerPoint within a file and post it on Blackboard, and I'd like to have that by March 8th if possible. The individual aspects of the presentation will basically be, you're going to do a presentation on the disease as a whole. First, you're going to talk about the agent. What is the actual biological agent? Is it a bacteria? Is it a virus? You're going to talk about the mechanism of disease. Is it caused by a toxin or inflammation? Does it something like HIV? Does it actually cause disease in and of itself or reduce the immune system and so on? And then what is the infectious agent, the life cycle? Does it have a reservoir? All these other issues about the infectious agent that makes it such a pathogenic disease. And then if you're going to go into the disease burden, the epidemiology of it, where is it actually located, who is infected? Some examples include children under 5, or it could be localized to sub-Saharan Africa. Maybe discuss the number of deaths or the amount of DALYs, disability that's associated with it, and so on. Then you're going to talk about diagnosis and prevention and treatment options. How are you actually going to diagnose it? What are the specific symptoms of the disease itself, not the agent but the disease? And then what medications are available, if any, and then the preventions that exist if they're available and what they are, the strategies to do it. Then you're going to start talking about the global health strategy and the public health strategy related to it, such as if there's current vaccines, how are the vaccines distributed, if there's no vaccine and new vaccines are being developed, or if there are current vaccines and better vaccines are being developed, some issues like that. Some of the control, eradication, elimination strategies, whether they're local, specific to a country, specific to a region, or global, and so on. And then you're going to talk about some of the organizations that are working on the disease, globally, as well as locally within specific countries, and what their focus is. And then finally, if there's anything else you'd like to add. I leave this fairly flexible to you to do this, but as long as you include most of the, if not all of these individual categories, I'll allow you to discuss it as you will. Again, remember that this is mostly global public health focus, and we try to focus mostly on the developing countries. So if you can do a disease that affects that rather than a disease that affects developed countries, that would be much better, I think, for the purpose of this class. If you have any questions, feel free to email me, and again, thank you so much. Bye.